You're good? Okay. On March 24th, 2009, Chelsea Brown, a friend of mine, woke up not feeling well. She was not sure what was wrong, but she was overly tired, always hungry, and she just could not quench her thirst. The next day, she stayed home from school and again was suffering from the same symptoms. At 3:30, her mom drove her to the doctor's, and on the way, she mentioned an idea of diabetes, but Chelsea didn't think of anything. They arrived at the doctor's office, and sure enough, she was diagnosed with type 1 diabetes. Immediately, she started crying. Oddly enough, the only thing that went through her mind was the dance she was choreographing and how she couldn't be at rehearsal the following day to perform it. For over 2 years now, I've been very close to Chelsea, and I've learned a lot about diabetes in that time. Well, I have gone as far as testing her blood sugar and giving her injections of insulin, both of which I'll get into more details a little bit later. Today, I would like to inform you about the different types of diabetes, the causes, and the treatments that can control it. So, let's begin with the different types of diabetes. Of course, according to Melissa Stopler on Medicine.net, type 1 diabetes, the pancreas undergoes an autoimmune attack from the body itself. In other words, the body begins attacking the pancreas, preventing it from producing insulin. The pancreas stops or slows production of insulin, which regulates the amount of sugar in your body. Without the insulin, the body can't convert the sugar from the food into the energy shells that it needs. Type 1 is the less common of the two types of diabetes and is more common in children, but it can happen at any age. According to understanding pathophysiology, in type 2, patients produce an adequate amount of insulin in their pancreas than is normal. In most cases, the patient's pancreas produces more insulin than it should be. A major feature of type 2 diabetes is a lack of sensitivity to insulin in the cells of the body. This is very evident in the fat and the muscle cells. Sometimes the release of insulin by the pancreas may also be defective and below average. This causes a steady decline in beta cell production, which leads to worse glucose control. Therefore, people with diabetes naturally have a higher blood sugar, which is why they need insulin to lower it. So, now let's take a look at what causes different types of diabetes. According to the Juvenile Diabetes Research Foundation, the exact cause of type 1 diabetes is unknown. While it is believed that autoimmune, genetic, and environmental factors may contribute to the cause of diabetes, more research needs to be done so the exact cause can be shown. People with a history of diabetes in their families run a greater risk of having diabetes. In Chelsea's family, her grandmother had diabetes and her grandmother's grandparents all had diabetes. According to MedlinePlus.com, type 2 diabetes is caused by a direct result of poor eating habits, higher body weight, and a lack of exercise. Family history is also in play, and those causes increase the chances for someone to contract the disease. So now that we've learned the types and the causes of diabetes, let's look into some of the treatments that are available. According to the American Diabetes Association, type 1 can be treated by using insulin injections and pumps. So here we have insulin pen. Here's where the insulin is, this is insulin cartridge where the insulin comes out, and over to the side is a dial to control how many units of insulin is ejected. And to test your blood sugar, there's a glucose meter. So you put in a test strip, you get blood out of your finger, put it in the test strip, and your blood sugar is read on the meter. So if your blood sugar is too high, that is when you use the insulin pen to put insulin in your bloodstream. So like I said, you can use insulin shots, and those used before meals to inject insulin straight into your bloodstream, which will lower your blood sugar. If too much insulin is taken, the blood sugar becomes too low and your body will go into shock. Symptoms of shock: you become ultra sweaty, your body's in a weakened state, and you become shaky. If that's not treated, your body could shut down. Type 1 can also be treated by using an insulin pump. So the pump delivers rapid, short-acting insulin injections into your body using a catheter which is attached under your skin on your side. Pumps are more popular with patients that need a lot of insulin throughout the day. For type 2 can be treated by weight reduction, if necessary, a diabetic diet, and exercise. The diet would be low in carbohydrates, such as proteins and vegetables. If needed, oral medications can be prescribed for type 2 patients. So today I've covered the different types of diabetes, the causes, and the treatments that can control it. So let's go back to Chelsea, my friend we met at the beginning. After 3 years of living with diabetes, she continues to lead a healthy and fulfilled life. I know, while it may be annoying constantly checking your blood sugars, you're ejecting blood from your fingers, and calculating how much insulin you need before meals, it's essential for her survival, but it doesn't control her life. She is currently a dance major in college, and she is one of the strongest people I've ever met. She's in extraordinary shape, and her doctor credits this with why her diabetes is so well under control. She has taught me a lot about diabetes, and that even though she has diabetes, it doesn't mean that diabetes controls her.